Good morning, everybody. My name is Chidinma Onyekwe. Today, I present a 24-year-old lady with a history of anxiety and depression for the past 6 years. Patient had a traumatic childhood that involved homelessness, sexual and physical abuse, pregnancy, and childbirth. This resulted in a feeling of hopelessness, loss of self-worth, and self-dignity. Her psychiatrist believes she will benefit from therapy, hence the referral. Three psychotherapy modalities that will be used for these patients are: one, psychodynamic therapy, specifically free association; humanistic therapy, specifically the existentialism; and the cognitive restructuring, which is a type of cognitive behavior therapy. First of all is the psychodynamic therapy, the free association. Psychodynamic therapy emphasizes how certain life events and relationships, both past and present, affect your current feelings, relationships, and choices. The primary focus is to reveal the unconscious content of a client's psyche in an effort to alleviate psychic tension. The key words here are: one, the unconsciousness, which is a reservoir of feelings, thoughts, urges, and memories that are outside of our conscious awareness. It contains contents that are unacceptable or unpleasant, such as feelings of pain, anxiety, or conflict. The next keyword is the psychic tension. This is emotional strain experienced in emergencies or other situations that generate inner conflict or anxiety. This modality is appropriate for this case because it will help the client acknowledge and understand negative feelings and repressed emotions so she can resolve internal psychological conflicts and improve life experiences, self-esteem, and relationships. The second psychotherapy modality is the humanistic therapy, the existentialism. This therapy adopts a holistic approach that focuses on free will, human potential, and self-discovery. It aims to help one develop a strong and healthy sense of self, explore your feelings, find meaning, and focus on your strengths. This therapy has a core belief that people are good at heart and capable of making the right choices for themselves. The keywords include free will, which is the power of acting without the constraints of necessity or fate, the ability to act at one's own discretion. Another keyword is human potential. It is the innate ability of every person to live or perform in alignment with their highest self. And the next keyword is holistic approach, which means to provide support that looks at the whole person, not just an aspect of the needs, but the whole person in general. Humanistic therapy will be appropriate for this client because it will address the leading cause of the problem rather than just the symptoms. Finally is the cognitive behavioral therapy, specifically the cognitive restructuring. It is a short-term, goal-oriented therapy that focuses on the link between our thoughts, cognition, and our actions, behavior. It is intended to help change thought patterns that cause unhealthy, unproductive, or incapacitating behavior. The keywords include goal-oriented, which means to focus on reaching a specific objective or accomplishing a specific task. Thoughts, an idea or opinion produced by thinking, occurring in the mind, in this case, a negative one. Then actions, the process of doing things, the accomplishment of a thing, usually over a period of time. CBT is appropriate in this case because this client is always having negative thoughts and always referring to the past. CBT will help to restructure those negative thoughts and focus on the present. The expected overall encounter for this patient. The psychodynamic approach was first applied over a period of 6 months. Symptoms improved, but more was needed to be achieved. Then the humanistic therapy was introduced. Because this is a more holistic approach, patient was able to develop a sense of self and focused on her strengths. Finally, a cognitive restructuring approach was used to change patients' negative thoughts to positive thinking. Cultural diversity. Cultures differ in their attitude towards major life changes, which means Solutions for common disorders are not one size fits all. As an African American lady whose culture shows great resentment to diagnosis of psych and mental health disorder, the use of pharmacotherapy attracts great stigma. This gives all forms of psychotherapy an edge over pharmacological treatments. The interaction of these three modalities was unique and tailored to the individual and her context. It is a very acceptable combination by her cultural standards, since they are usually hesitant about the use of medications. I'm going to let my client in now. And for the first modality, we're going to do the psychodynamic therapy. Come in, Miss Olivia. Good morning.
Good morning, Miss Chidi. How are you?
I'm fine. How are you today?
I'm good.
Do I have your permission to do this demonstration for academic purposes for my school, UMass Global, and have it posted to the school social media?
Yes, you do.
Thank you very much, Miss Olivia. How are you today?
Well, I'm supposed to be fine, but I don't think I am. I'm just here.
Tell me about your childhood. Just speak freely. Try to focus. Say anything that comes to your mind. It doesn't have to be meaningful. It doesn't have to be in sequence. Just say it as you remember it.
Oh my God. Miss Chidi, you're just taking me back the memory lane. I hate to talk about my childhood. It's nothing to write home about. Sexually abused. Mom hates me because I'm a product of rape. Grandpa sexually molested me, raped me several times. I was pregnant at 15. Grandma kicked me out. I don't know who my father is. My mom doesn't know either. I was beaten at the slightest provocation, homeless, days without food on the street. Oh God. Mom said I ruined her life. Can you imagine that? So much rejection, financially handicapped, frostbite in winter, and sunburn in summer. Nobody cared. Lies ate me up, lost a finger. I got my body in exchange for accommodation. Forced to sleep with a dog. Will be thrown out of the cold if I refuse. I feel so dirty now. I take my baths 6 times in a day to clean up. I wash my hands every 30 minutes.
Tell me about your relationship with your husband. Say anything that readily comes to your mind.
Miss Chidi, why are you doing this to me? Why are you just taking me round and round my past? He cheats me all the time. He doesn't love me. His ex-wife left him 2 kids. He just needed me to look after the kid and take care of them while he does his things. Oh my God. One has serious health issues. I love them, or at least I have accommodation with my daughter.
I see you've gone through a lot growing up. I want you to understand that the unconscious has one of the most powerful effects on behavior and emotion. No behavior is without a cause and is therefore determined. Childhood experiences greatly affect emotions and behaviors as adults. Your obsessive hand washing and frequent baths is most likely linked to this childhood trauma that now causes this behavior. I also see you bite your fingers and pull your nails and pull your hair. This may be caused by anxiety-producing childhood events. Any questions you want to ask me?
I don't have any questions, Miss Chidi, please.
Okay, thank you, Miss Olivia. If you have any questions, don't hesitate to ask me, okay?
Okay.
Having done the psychotherapy for the past 6 months, we want to try another type of therapy, the humanistic existentialism. Welcome today, Miss Olivia. How are you?
I guess I should just watch each day as it unfolds and see what it holds for me.
You are capable of influencing what the day will bring. You know that?
How on earth can I achieve that?
You don't have to live in your past. How about moving on with your life? You once stated that you wanted to be a nurse. How about following up on that dream?
I thought of that, but are you sure I'm capable of doing that?
I see you as capable of doing anything you set your mind on. At the end of the school, you will become a nurse. You will get a job. You will be able to do anything you want to do. You'll be able to pay your bills. You will be able to give your daughter the kind of childhood you desired but didn't get. You will be independent. You won't need anyone to satisfy your financial and basic needs.
What is the essence of becoming a nurse? Will it change my past?
Miss Olivia, it might not change your past, but it will create an identity for you. It will help you search for the meaning and purpose and values of life. Does that make sense?
Yes, ma'am.
In addition, it will help you have the capacity for self-awareness, experiencing tension between freedom and responsibility. We are finite as humans. Our time is limited. You are just 24 years old. You have the potential and the choice to act now or not to act. As humans, we are subject to loneliness, meaningless, emptiness, guilt, and isolation. But the way we go about it, that's what makes the difference.
I see. I understand your point, Miss Chidi. I will think deeply about it tonight, okay?
Take your time. Reach out to me with questions. You know I'm always here to help you. You know where to find me, okay?
Thank you so much, Miss Chidi. You have been a great help to me. I will definitely keep you posted.
Thank you so much, Miss Olivia.
You're welcome.
Today, we are moving on to the third psychotherapy method, which is the cognitive restructuring, a type of cognitive behavioral therapy. Good morning, Miss Olivia. How are you doing today?
I guess I'm not fine. How can I be fine when nobody loves me, nobody cares about me? Am I that terrible, Miss Chidi? Can you tell me?
I don't see you as terrible. Why did you say that?
But it is true. I am terrible at everything I do. I make mistakes. My sister does things right. Everyone loves her.
When you say nobody loves me, nobody cares about me, what is your evidence?
Oh, I know. When I look at them, I see it. It's so obvious. If I wasn't terrible in everything I do, they would probably love me.
How often do you make mistakes?
Oh, very often. Not so often, though, occasionally.
Do you do good things at times?
Oh, yeah. But nobody notices that because everybody hates me.
Has your sister ever done any of the terrible things?
Oh, yeah, every time. But everyone loves her, so they don't complain.
Tell me about one terrible thing she has done recently.
She spilled water. The other day, she spilled water on the floor, and Grandma fell. If I did that, I'll be thrown out of the house.
This means we all make mistakes, right?
I guess.
Mistakes don't make us terrible, Miss Olivia. They make us human. I want you to say this over and over every day. You are a good person. Everybody makes mistakes. Instead of saying, I am terrible at everything I do, you can say, although I made this mistake, I do many things correctly, and now I have learned from this error. Does that make sense?
Yes, Miss Chidi.
Say this each time you make a mistake. You can say, I've made a mistake, but in general, I work very hard. I am genuinely trying my best. I have gotten good feedbacks in the past, so I know I am doing it right. Challenge yourself to make small steps. Challenge your negative thoughts. When the thought of I'm terrible at everything I do comes, just say to yourself, nope, I'm not terrible. I have gotten good feedbacks, so I know I am doing great. Continue to practice positive self-talk. Always reframe your negative thoughts. For example, instead of saying, I'm so bad at this assignment, you can reframe the statement to, I don't feel like I did well in this assignment. I will do better next time. Am I making some sense?
Yes, Miss Chidi.
Furthermore, spend time with people that make you happy. Very, very essential. I want you to practice self-compassion. What do we mean by self-compassion? Self-compassion means accepting your negative thoughts, mistakes, and failure. See them as messy human moments. It's okay not to feel great at times. Don't let those moments define you, okay?
Okay.
Remember, you are never alone in your mental health journey. Everybody has been where you are at one point or another. And most need a little help to get through. Please always ask for help. Do you have any questions?
No, Miss Chief, but I just want to say something. With all these things you've told me so far, do you think I can still make it in life?
You can. I see you as a very strong lady. I see you as a lady who has very great potentials. I see a strong woman seated right in front of me who has the will, who has the strength to move on with life. It is just about you making the decision to do it. You can set a goal for yourself. You can say, by this time, this period, this is what you want to achieve. I know you can do it, Miss Olivia. I want you to tell yourself, I can. Remember the code, I can. Just say, I can. I want to hear you say it, I can.
I can.
I know you can. I trust you. I am confident in you. I believe in you. I know you can do it. Right? I like that smile.
Right.
I like that smile. Thank you, Miss Olivia. Thank you for the opportunity given to me this day. I appreciate that very much. You know where to find me. Beckon on me anytime, and I'll be more than willing to help, okay?
Thank you, Miss Chidi. You've made my day.
Thank you so much.
You're welcome.
Right. In summary, it was Miss Olivia, a 24-year-old African American with a history of anxiety and depression, with some signs of OCD, referred for therapy by her psychiatrist. Therapy started with psychodynamic modalities, which lasted for about 6 months. There were improvements, but a lot needed to be achieved. Therapy modality was changed to humanistic therapy, specifically existentialism. Client responded positively to this, but still harbored some negative thoughts which were affecting behavior. In order to get rid of these negative thoughts and replace them with more positive ones, a cognitive restructuring approach, which is a form of CBT, was used. Clients realized the need and the ways to get rid of our negative thoughts and replace them with positive thoughts. And that brings me to the end of this discussion with Ms. Olivia. Thank you so much for listening. I appreciate your presence. Bye.